Hi, Dr. Desmond White. I'm still on the topic of acute appendicitis. Can CT scan of the appendix fail us? We mentioned that nowadays we depend on CT scan to confirm the diagnosis, but can CT scan fail us? Answer is yes, it can fail us. Very few things in medical sciences are 100% accurate with zero failure rate. So let me share two patients. The first patient is a lady in the mid-30s, went to the A&G department for right lower quadrant pain. They touched the belly, well, nothing very much. They did a CT scan of the appendix and it was normal. So they told the patient it's not appendicitis because the scan was normal. So she was happy, she went home. The next day she went back to A&E again. She said, hey, my pain get worse. And the patient was admitted under me as a tummy pain for investigation. CT scan showed not appendicitis. So when I talked to her, I felt that the pain was quite characteristic of appendicitis. Started around the belly button, shifted to the right lower quadrant a day later, and the pain got more and more and more. So the third patient, well, I think clinically you look like having acute appendicitis. But the patient said, but CT scan was normal yesterday. I said, yeah, CT scan when it's too early may not show up. So we have two options. Either we repeat the scan or we take out the appendix. She said, I want to be very sure. So we repeat the CT scan one day later after the first scan. So the scan indeed showed a swollen appendix. She did appendix surgery and she recovered and went home 2 days later. So what happened is that in acute appendicitis, when it's too early, appendix was swollen, but not swollen enough to be seen on the CT scan. Don't forget, on the CT scan, we look at images and there will be certain margin of error. So that was the first case. Second case, similar case. Admitted for right abdominal pain. Did the CT scan normal. So she was admitted under another doctor. The doctor told her, well, it's not appendicitis because CT scan say so. And he started the patient on antibiotic, and sometimes acute appendicitis, when you start antibiotic, they improve. I mentioned in the earlier post before. So her pain improved initially, but after a day or two, it got worse. So the family wasn't happy with the first doctor. They called me to come in for a second opinion. When I saw the patient, I touched the right lower quadrant. It was very tender. The patient jumped. So I told the patient and the family, I think it sounds feel like appendicitis. Again, the patient's family say, no, but a scan done 2 days ago showed it is not appendicitis. And again, I explain, I say that in acute appendicitis, the appendix is swollen. If you do the scan too early, the swelling wasn't bad enough to be shown on the CT scan. And with antibiotic, patient improved. But if it's appendicitis, a lot of time they will get worse, even with initial improvement. So the pain get worse, and I told them two options. We can repeat the CT scan or we can go straight to take out the appendix, because now the right iliac fossa was tender, is very definite. So the patient opted for operation. So I don't operate as I'm a physician. I asked the surgeon to operate. The surgeon did the laparoscope. Indeed, the appendix was swollen. We took out the appendix and patient again went home 1 or 2 days later. In both cases, what happened is that when the patient has tummy pain, if we do the CT scan too early, the appendix is not swollen enough. So that's why they didn't show up on the scan, and we dismissed that as a non-appendicitis. But appendicitis, I always say, the pain will get worse and worse and worse. Patient will come to the A&E. So both cases, one case repeat the scan because she requested. Another case, patient say, Dr. White, you were so sure, let's go in. So went in, take out the appendix. The take-home message is, if you have tummy pain, early CT scan, if it's done too early, it may not show appendicitis. But if you have tummy pain and the pain shifts to the right lower quadrant, get worse and worse and worse, together with fever, bloating, generalized unwell, vomiting, then maybe it is appendicitis. So the take-home message is, if you have tummy pain, if it gets worse and worse and worse, please come and see the doctor, preferably the same doctor, because he knows you better. The first CT scan shows appendicitis, operate. Even if the first CT scan is normal, if your pain is characteristic of appendicitis and it gets worse, do consider appendicitis as a possibility and do going back to see the same doctor. So remember, nothing in medicine 100% accurate. We still need doctors to make a clinical diagnosis. I hope you have. Dr. Desmond White.